You take out your needle.
A weekly jab and the pounds just fall away.
That is it. 9 times out of 10, I don't even finish what I've got.
The weight loss drugs available to those who can afford to pay, but out of reach for most on the NHS.
We are unable to offer medication.
Yet doctors know the drugs save lives.
We know we have something that we can offer them, but are unable to offer it to everyone who could benefit from it.
Ozempic, Wegovy and now Mounjaro, a revolution in the treatment of obesity. So why the wait for the weight loss drugs?
It's just a slow, painful process. But I get to see my family all the way up the stairs, which helps make it a bit more bearable.
For Ken, every step is painful. He needs a double knee replacement, but at 25 stone, he's considered too high risk to have surgery.
And you can see I'm huffing and puffing just for coming up that.
He's been told to lose 5 stone to have the operation, but that's difficult in his condition.
I hate the fact that I can't even go for a walk with my grandkids now. I've made lifestyle changes. I eat sensibly. I don't eat big crazy meals. I think the biggest issue is my knees are kind of wrecked now, and a diet doesn't really work if you don't balance it with sensible exercise.
His last hope was the weight loss drug Wegovy, the only way he'd slim down enough to get his knees fixed and his old life back.
So this is the actual referral form.
The GP confirmed he was eligible and referred him to the specialist hospital clinic.
The thing that really got me excited was the clients whose surgery is dependent on weight loss, and that was ticked. I thought that would be opening the door to let me get access to the drug.
Then back came a text.
Currently our waiting list is around 2 years and we are unable to offer medication. If you no longer want this referral, please contact us. It's all shocking, isn't it? I just wonder how many other people are getting this.
Wegovy and its identical twin Ozempic have become pharmaceutical gold, sales so high that their Danish manufacturer is worth more than the country's entire economy. They both contain semaglutide, mimicking a natural hormone. Ozempic helps to reduce blood sugar in people with diabetes. Wegovy is licensed for weight loss, making people feel fuller, faster. The pounds just fall away.
You can actually order it. It's about £200 a month. So I sort of considered purchasing it or going private, but I thought, no, I've paid into the NHS all my life and I've hardly ever been in hospital. I've had no major operations at all. So I'm stuck in a kind of quandary in a loop. I don't know what's next.
What do we know about where these drugs work?
So they're produced from the small intestine, so this is a small intestine here.
Dr. Robert Andrews is one of the country's leading weight management specialists.
The first place they work is the brain. They affect appetite and give you a feeling of fullness.
He says obesity costs the NHS £6 billion. It's linked to 200 different diseases, and half of all obese people with 3 additional problems, such as high blood pressure, will be dead within 10 years. And yet he sees stigma in NHS and government policy.
So it's about the only disease that the government blames on a person. We don't blame cancer on patients, we don't blame anything else on patients, but the government blames the patients that they're the cause of it and it's their fault, even though a lot of things that they make decisions on cause obesity.
And he sees that even in the way the new obesity drugs are being used by the NHS. Wegovy should have been available through specialist hospital clinics since December, but Freedom of Information requests by Sky News show that by the end of April, only 14 out of 42 integrated care boards in England had officially rolled out the drug through clinics, prescribing the drug to just 838 people. That's much less than the 13,500 patients that NICE, the NHS Cost Effectiveness Authority, estimated should be receiving the drug.
It's difficult for all of us that work within the NHS. We know we have something that we can offer them, but are unable to offer it to everyone who could benefit from it. Money follows for other illnesses, but doesn't follow for this illness, and the particular illness you're dealing with. And that's really a form of bias, and seeing that within the NHS is a bit soul-destroying.
NHS England said specialist weight management services are provided based on local priorities, and it's working with the government, industry and experts to ensure that new treatments can be rolled out safely, effectively and affordably.
I used to add ice to it.
Sally gave up on the NHS providing treatment. Name a diet and she's probably been on it.
Oh, I'd tried everything, yeah. And I've done shake diets more than once, but they all went the same.
Which was what?
I'd either give up, get bored with all the flavours, and then you go back to your old ways.
The weight loss clinic at the local hospital was no more effective. 18 stone and desperate, she asked her specialist nurse for Wegovy.
They said no.
Did they give a reason?
I wasn't diabetic, but I said my BMI is a tick and I've got very high blood pressure. And she blatantly said no and literally put the phone down. I was in tears. I cried at my desk because I really thought that I was going to possibly qualify for this weight loss injection.
She's seen the TikToks, people visibly shrinking on Wegovy, so she went private and hasn't looked back.
So how much have you lost?
3 stone 4 pounds. And what I'd noticed on previous diets is I never used to feel full. I could eat a very big meal and still want more. Well, now my food is on much smaller plates, and 9 times out of 10 I don't even finish what I've got. A couple of mouthfuls and I'm satisfied. It was quite bizarre to have that full feeling that I hadn't had for 49 years.
Sally says the drug is her lifeline. She keeps 2 months' supply in her fridge so she doesn't run out. Once a week, she dials in her dose to the injector.
So the penny's charged, you grab your skin. That is it.
But a month's supply costs more than £160. Her dad helps her out.
Is it worth it?
Oh, most definitely. I'm a different person.
There'll be lots of people who say, do it the hard way, do it with diet, do it with exercise, don't go for an injection.
Yeah, I've done that. Even my boss said, why would you want to be putting that drug in your body? Because I'm desperate.
We've never done anything for these people. We've never provided programmes that help them stop gaining weight. We've got to treat the problem that we didn't treat, and we've got to just man up and spend that money. And what we then got to do is put the money into making sure the environment's right. We need to make sure that food industries can't get away with cheap, poor quality food, and that the best food that you get is cheap, and stop the new problem coming.
2/3 of the population is now overweight or obese. It's the destiny for the next generation too, and they can't all be on weight loss jabs.
No, you can do the broccoli because I know you're good at it. Yes, of course you can.
Kay's hoping for a reset, starting with her own kids. Most nights they cook from scratch.
Can you cut these smaller for me? And maybe your cucumbers smaller, but just watch your fingers. It's trying to educate them before we get to that stage. Obesity's been a pandemic way before anything else. If we can try and sort the root of it now at childhood and educate, then that is my hope, and that's what drives me. And give it a smoosh.
It's her own obesity journey that spurs her on. Her weight rose steadily from an early age. By the time she had kids, it was hard to keep up. Back then, there were no weight loss jabs. She had surgery to make her stomach smaller.
There you go.
That looks like you were in hospital. Was that just before surgery?
Just before I went down to surgery. I was 22 stone 11 at that stage. I would never dream that on my worst enemy, feeling that hatred for yourself. And then when you do ask for help, it's, well, you just eat less and move more. Or as a GP said to me, go get a dog, start moving. It's not as easy as that. Am I missing a pudding? Of course I am.
What Kay started at home, she now takes to work. She's the catering manager for 8 schools across the north of England. Her menus feed more than 5,000 children, and they tempt hungry mouths to try something new and healthy.
It's very hard to convince some of the children to try something new.
What really didn't go well? I know obviously
Leeks.
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 Don't put leeks in the recipes.
Do you think that this is something that we just can't change?
I think we can change certain things, but we've got COVID kids
Yes.
that we're used to eating just grab and go stuff at home, finger food at home, quick and easy food at home, and it's going to be really hard to re-educate them. We just keep trying something new. Just try it, it's free, just try it.
Can I have a roast dinner, please?
You can.
Healthy habits started young just might prevent weight gain later. Perhaps fewer will want or need jabs.
The culture and the habits that we're currently experiencing outside of schools is something that really needs to change, and it needs to change quickly. But if I can do my bit and make sure that my third of the calories that I can offer our students are the best calories that we can give them, then that's what I will do.
Ready, go!
But what about the millions of adults struggling with their weight today? Drugs like Wegovy result in weight loss of 15% or more in a matter of months.
This may be the one that is going to get me where I want to be.
The NHS is under pressure to prescribe, but can't afford the bill.
I think it reflects that we've not taken the illness seriously.
And that's forcing patients to choose, pay up themselves or join a long and lengthening queue.
My family are great. They're fantastically supportive. They can see what I'm going through. It's not good.